When you perform a socket preservation case, it's very important to achieve primary closure. In my experience, not achieving primary closure will allow EthOss to escape around the wound edges. When I explain to patients, I say it's like going to the beach. The sand will get everywhere. EthOss will escape and try and get out of the wound, and patients will report some gritty granular powder in their mouth over the coming days. However, it's important to note the majority of the graft will be retained inside the socket or graft area. But that's why it's important to achieve good primary closure. I place single interrupted sutures, but I always place a couple of extra ones as insurance, because understandably some do work their way loose or get ripped out, especially upon a little bit of swelling or patient movement. Another factor to consider is, like all grafting cases, you need to allow the wound to be immobile. Any movement of the graft, whether by patient muscles moving, smiling, eating, or in function, or with the denture resting on top of the wound, will not allow optimal bone grafting. Bone only forms and sets when it is immobile, just like when you have your arm cast or either pinned in, say, a cast. Importantly to note for aftercare as well, I give all my patients a week-long course of antibiotics to stop any rejection of any graft, or also any nasty bacteria which I may have introduced inadvertently during the surgical procedure. I also give my patients complimentary a bottle of Corsadil and ask them to leave the first 24 hours, but after that carefully bathe the wound in Corsadil twice a day. And when I say bathe, I mean roll the solution carefully around, being mindful to not force it under the flaps of mucosa or stitch down gingiva, because the last thing you want to do is be forcing this Corsadil under the flap and then of course removing any particulate. So bathing it is literally as it sounds, it's just gently rolling the solution over the top, carefully trying to not disturb the underlying graft. Also avoiding any hot drinks or food for at least 2 or 3 days, and avoid eating on that side or area if they can for another 2 or 3 days. Understandably, usually after surgery, it's a bit sore anyway, so the patients will naturally want to avoid those actions.